Here's the superior vena cava, the inferior vena cava, and then right here is the right atrium. Then it opens up. Here's the tricuspid valve. Then right here is the chordum tendineae, and then the papillary muscle. And then this is the right ventricle, pulmonary valve, and it leads to the pulmonary trunk. And then this branches off into the pulmonary arteries and goes into the lungs and then comes back in and then goes to the left atrium, which is right here, then goes down the valve into the left ventricle. Then from there it goes through the aortic valves, which is somewhere in here, and then it goes out to the aorta. And then back here, this is the brachiocephalic, and it branches off into the right and left common carotid and the right subclavian, and then this is the left subclavian. This is the coronary vessel.
Has two sides, a right side and a left side, and four chambers: the top receiving chambers, or atrium, and the lower chambers, which are thick-walled pumping chambers, called the ventricles. Red blood cell will come from either the superior vena cava or the inferior vena cava and enter into the right atrium. The blood then flows across the tricuspid valve to the right ventricle. The right ventricle then squeezes and ejects that blood cell into a vessel called the pulmonary artery. Pulmonary artery splits into two vessels, each going to the lungs. As that red blood cell makes its way through the lung, it returns through the pulmonary veins to the left atrium. That blood is now oxygenated. It's picked up oxygen, then goes across the mitral valve into the left ventricle, which does most of the work in terms of delivery of blood flow to the body. That blood cell is now ejected into the aorta to some organ or muscle or skin in the human body.
I'm Dr. Slavens. How you doing today?
Nice to meet you, Doc. I'm Ty.
I've noticed lately I've been having a shortness of breath. I've been getting really fatigued quickly lately, so I'm kind of curious as to what's going on with me.
All right, well, let me get your, let me test you out here a little bit.
Your heart has been beating rapidly, so we're going to do an echocardiogram on you, which is basically an ultrasound of the heart to test some things out. The results from the echocardiogram, I see a hole in the atrial wall.
This figure is blood coming to the right atrium from the body, going through the fossa ovalis into the left atrium. On the right is an echocardiogram from an adult patient in whom this membrane did not close, so a PFO, and you can see bubbles that are introduced into the right atrium here that transit across the PFO here and end up in the left atrium. Now, you can imagine a scenario in which blood clots could similarly pass as these bubbles, and once they end up in the left atrium, they can pass through to the aorta and then to the brain, causing a stroke.
So when you were born, that hole was supposed to close up, but in your case, it hasn't. So to help that, we're going to perform a patent foramen trench catheter to repair your heart.
Thank you, Doc.
Of course.
ASD is a congenital heart defect in which blood flows abnormally between the two atria of the heart. Normally, the atria are separated by a wall called the interatrial septum. In ASD patients, this septum is defective, allowing blood flow between the two chambers. During fetal development, when the interatrial septum is being formed, a small passageway called the foramen ovale is left open to allow the blood to bypass the non-functional fetal lungs while the fetus obtains oxygen from the mother's placenta. At birth, as the lungs become functional, the changes in pressures between the two sides of the heart force the opening to close. However, in as many as 1/4 of all adults, this opening does not close properly, resulting in ASDs.